I'm Krista Hughes, the founder and CEO of Hughes Advocacy, in which I am a board certified patient advocate. I'm also an educator at the Leapfrog Judy Burroughs Education Institute, which is the educational arm of the Leapfrog Group. Leapfrog is an independent, nonprofit organization that rates hospitals and ambulatory surgery centers on how safe they are for patients. Today, I want to talk to you about something very important and that protects your privacy when you get healthcare, and it's called HIPAA. That stands for the Health Insurance Portability and Accountability Act. It's a law that keeps your personal health information private and safe. Now, this is a tremendous issue that I have with my clients who are age 55 and up, and it's extremely frustrating to the patient and their family when you are denied your rights. When you visit your doctor or go to the hospital, you share a lot of your personal information about your health, like your medical history, test results, and treatments. HIPAA makes sure that all your information stays confidential. It means your health details cannot be shared with anyone without your permission. So why is this so important? Because your health information is private and sensitive. You deserve to control who sees it. HIPAA protects you from your information being shared without your consent. Now, sometimes you may want someone you trust, like a family member, friend, or a professional patient advocate, to help you with your health care. Maybe you feel overwhelmed, or you want someone to speak to your doctors, ask questions, and help you understand your care. That's where your advocate comes in. But here's the thing. Your advocate can only get your medical information if you give permission. And the way you give permission is by signing a form called the HIPAA authorization form. So what is this HIPAA authorization form? It's a document that you fill out to say who you trust as your advocate or family member or caregiver, what information they can see, and how long they can have access. Without this form, your healthcare providers may not legally be able to share your information with your loved ones or your advocate. So how do you get and fill out this form? First, ask your doctor's office, hospital, or healthcare provider for the HIPAA authorization form. They are to provide it to you. Sometimes you can find it on their website or on your patient portal. Make sure you fill it out carefully. Write your advocate, family member's full name, their relationship to you, specify what information they can access, sign and date it. Return it to your healthcare provider as instructed. So what do you do if you're being denied the ability to add or talk to someone? This happens 90% of the time with my clients and me, denying me access. If you've already submitted the HIPAA authorization form and your healthcare provider still refuses to allow your advocate access to your information or won't communicate with them, this is a violation of the HIPAA law and your civil rights. When they deny you, you have the right to ask for the healthcare provider's privacy officer, and you can explain the problem to them, or you can file a complaint with the U.S. Department of Health and Human Services if that's needed. So here's a brief example. Let's say your advocate calls the hospital and they say, we can't talk to your advocate because we don't have permission. You should fill out the HIPAA authorization form to give this permission. But if you've already given the permission, they still say, no, that is not okay. You have every right to take action and protect your rights. Because in summary, HIPAA protects your health information and gives you the control over who sees it. Your advocate can be a valuable help, but only if you take the important step of signing the HIPAA authorization form. And if you ever feel blocked or denied, remember, you have the right to stand up for your privacy and get the help you need. Thank you for watching this video today. For more resources, please visit the Leapfrog Judy Burroughs Education Institute. And if you have any questions for me as a patient advocate, please reach out to me via my website at hughesadvocacy.com. Thank you and have a great day.